Hi, Thad Michael here. Senior Benefits by Thad Michael. That's my company. That's who I am. I've been doing this approximately 30 years. You probably hear because you're turning 65, you've lost your health insurance, or you are in open enrollment for Medicare. I am going to give you a very short presentation about Medicare, the A, B, C's, and D's, the 101 of Medicare, whatever everyone likes to call it. I am going to give you just straight facts, how it works. At the end of this video, you'll have an opportunity to set a personal appointment with me so we can figure out what your personal and specific needs and wants are, and we'll go from there. The reason this is recorded instead of a live webinar is I want you to watch this at your convenience. No pressure. Turn it off, turn it on. Don't ever come back. That's okay. I am not a videographer. I'm a Medicare insurance agent. I am not a model, as you can tell. So I'm not going to woo you with some crazy whammy jammy words. I'm just going to explain how this works, and you can determine from there what makes the most sense for you. Hopefully that's fair. So like I said, I've been doing this for 30 years. I'm primarily in California. I do work a lot of other states. I'm a licensed Medicare broker since 1996, so almost 30 years. And I am a U.S. Navy veteran for 8 years, 4 active, 4 not so active. I was stationed in Pearl Harbor, which was amazing. When I was a kid, my parents could never go to Hawaii and they wanted to. So in A school, I graduated number 3, not number 1, but I tried. And I was able to pick where I wanted to go, and it was Hawaii. So it was a great opportunity, loved it. As soon as I got out of the military, I went into insurance and started in Medicare. Haven't looked back since. My youngest is 14, my oldest is 29, and I have 4 kids. Other than that, you don't need to know much about me. Hopefully, the information I give you tells you enough about me. So, Medicare, Part A, Part B, C, and D. ABCs and D. Medicare has 4 parts. In 1965, Lyndon Johnson stroked into law Medicare, original Medicare, which is Part A and Part B. Part A, that is your hospital insurance, okay? Everything that has to do with the hospital is covered under Part A. That is given to you. You are entitled to get Part A because you're an American citizen and so forth. Part A covers 80% of the bill, minus some deductibles and minus 20%. Part B is the medical insurance or doctor's insurance, outpatient surgeries, lab results or labs, and doctor visits is covered under Part B, which again is covered at 80%. You're responsible for the 20% plus some deductibles. That is considered original Medicare or traditional Medicare. Part C and Part D, somewhere around 2006, the government had to get their hands in the cookie jar again and created Part C of Medicare, which is Medicare Advantage plans. In the next slide, I'm going to talk more about that. And Part D is the drug program or prescription program to help offset your costs. We'll get more to that in about 3 or 4 slides, but that's it. There's 4 parts of Medicare. There is theoretically a 5th part of Medicare, but it's not part of Medicare. It's called a Medigap plan, which we're also going to talk about, or a Medicare Supplement plan. Okay, those are the 4 parts. Very simple, very easy. It's not complex. It's not confusing, especially because we can figure that out together, which plan is the best to cover what Medicare does not cover. Okay. Now, Medicare Advantage plans, which is Part C of Medicare, how are they funded? This is important because that helps determine how good or bad the company is and how good or bad the benefits are. Okay. First of all, Medicare pays private insurance companies to manage your coverage. Okay. So I'm going to go back a slide and show you. Part A and Part B, I think it's opposite during these webinars. Part A and Part B is original Medicare. If you sign up for a Part C Medicare Advantage plan, you are assigning your Part A and Part B rights to the Medicare Part C insurance company. And by doing that, Medicare says, thank you. We no longer have to deal with Jimmy Crack Corn because the insurance company is. And because of that, they're going to pay the insurance company a fee on your behalf. Okay. It's called a capitation. Each plan gets a person per person payment, a capitation, to take care of you so that Medicare no longer has to deal with the billing. They don't have to deal with referrals. They don't have to deal with approvals and so on and so forth. So the insurance company takes over Part A and Part B. They get paid by Medicare. They also get funded by the federal government, which is CMS, Centers for Medicare and Medicaid Services. Nothing is funded by you per se. And I'll get into that a little bit later. Okay. The funding depends on two things. There's an actuator guy in the background who says Placer County, Sacramento County, LA County, whatever county you're in, and they're going to crunch numbers and say, you are worth $650 per month, as an example. They're going to give that money to the insurance company to take care of your entire health care. Okay? That's kind of how that works. But they can get more or less money based on their rating system. The higher they are rated, the more money they get. Now, how does the rating system work? It's simply based on how you rate the insurance company with your experience and how the doctors and hospitals rate them. So the higher the rating, the more money they get, the more benefits you get, or less premiums, vice versa. Hopefully that makes sense. So what is a Medicare Advantage plan or Part C of Medicare? Simply put, a Medicare Advantage plan, also called Part C, is an all-in-one alternative to original Medicare. It's everything. It's your doctors, your hospitals, your labs. It's everything. And it's your drug program, generally speaking. It's offered by private insurance companies, Cigna, Aetna, Scan, Imperial, Alignment. There's tons of insurance companies in the United States that are private insurance companies that offer Medicare Part C or Medicare Advantage plans. It must cover everything that Part A and Part B covers and usually adds extra benefits. Usually is really broad brush view. It covers a lot more benefits than Part A and Part B, okay, which you'll see in a later slide. Most plans include a built-in Part D drug program, which is a good thing. You still pay your Part B premium, and many plans have low or $0 premiums, okay? Each plan uses a doctor network like an HMO or PPO. So the insurance you're on right now, if you're under 65 or you've been on insurance, group insurance, or any type of insurance in your lifetime, you're used to an HMO or a PPO. You've got a doctor's group and a hospital group. You have to get referrals. There's co-payments. There's deductibles. There are out-of-pocket maximums. There's stop losses. The Medicare Advantage plans are very similar, if not identical, to the plan that you're already used to. And that's a good thing so that it's not as difficult as you may think it is. It also includes an annual out-of-pocket max, which we'll go over in another slide. But I want to back up to this slide here. So I mentioned Part A is you're entitled to it. Part B, you have to enroll in it or elect to take it. If you do not enroll in it or elect to take it or pay for it, if you will, and I'll explain that in a minute, you will be penalized. So when you are eligible for Part B, if you do not enroll in it, and it's going to cost you currently in 2026, $206.90 per month out of your Social Security check, they will penalize you later. So if you wait a year just because you feel like you don't want Part B, they're going to penalize you when you do take it. So unfortunately, it's one of those things where everyone's got to be on it or they're going to penalize you later. Part D is also the same thing. When you're eligible for it, and the key is eligible, you must take it or they will penalize you later. It's on a percentage. There's, like I said, an actuary in the background that says, oh, it's going to be $3 extra per month, $8 extra per month, whatever, okay? Just wanted to make sure I went through that. So we went through Medicare Advantage plans or Plan C. It's basically an all-encompassing plan. It's an alternative to original Medicare, but it's all in one. Let's talk about the Part D plan. So the Part D plan in 2006 gives seniors prescription drug coverage that original Medicare never included. So it was stroked into law in 2006, and it was designed to help seniors with their prescriptions. It's a good thing because back in the olden days, I'm not that old, but I'm old enough, people that were on a Medicare Supplement plan or a Medigap plan did not get drug coverage. There wasn't any. They had to pay out of pocket. So what we used to help our customers with or our clients with is do a mail order from Canada. It was a lot cheaper. Some clients would actually drive down to Mexico. It was a lot cheaper. But in 2006, the government got smart and they helped out with that. It's offered only through private insurance companies approved by Medicare, not directly by Medicare itself. So the insurance company is the one who is in control of the Part D plan. Each plan has its own premiums, deductibles, formulary or drug list, and preferred pharmacy network. Okay. Beginning 2026, Part D has a true out-of-pocket maximum of $2,100. So you add up all of your co-payments, and if they go over $2,100 or once it equals $2,100, you then pay nothing. That's the out-of-pocket max. And Part D basically just protects you from the high cost of medicines. We'll go over what is the cost of Part D, the co-payments for tier 1, 2, 3, 4, and 5 and such, okay? Medicare Supplement. That is, call it Part E of Medicare. It's not Part E of Medicare, but it is another alternative or option for your health care when it comes to original Medicare, okay? A Medigap or a Medicare supplement plan fills in the gaps that original Medicare doesn't pay. So that 20% you would be responsible for Part A and Part B, the Medicare supplement plan will pay that. They'll also pay the deductibles. Depending on what plan you have, would depend on if you have any out-of-pocket expenses. So unlike a Medicare Advantage plan, you keep your Part A and Part B. Medicare is the primary. The supplement is the secondary. I think I need to flip that because we're on a video here. Medicare is the one that's in charge of your healthcare in the sense of billing, in the sense of referrals, what's approved and what's not approved, along with your doctor, of course. The supplement plan, in a nutshell, is a glorified bill-paying service. The bill goes to Medicare. The bill goes to the supplement company. The supplement company pays their portion. That's all the supplement company does. There's no networks. You can go to any doctor, any hospital, any lab, any specialist, anywhere in the United States. No exceptions, as long as they accept Medicare, which last time I checked, pretty much every doctor does accept Medicare, okay? Your coverage is predictable. Plans are standardized. What that means is the plans go from Plan A to Plan K, I believe it is. And if you have a Plan K with Mutual of Omaha, it's the same Plan K with AARP and Blue Cross and Cigna and so on and so forth. So each plan is identical. Plan G is a Plan G is a Plan G, no matter who the company is, okay? Your benefits are the same. So the goal is to get you a plan that fits your needs and wants and find the cheapest insurance company that's highly rated, and you're good to go for life, okay? The coverage is guaranteed renewable, which means the company can never cancel you. I'm going to say that again. The company can never cancel you unless you don't pay the premiums. But there's a kicker. There's a caveat to this. Premiums are expensive. I'll show you in another slide. For a plan like this, it's expensive. But if you travel, a Medicare supplement plan is perfect for you because there's no network, okay? The premiums will increase every year. They're going to say happy birthday, woohoo, and they're going to increase your rates. The rates are increased based on what's allowed by Medicare and the Department of Insurance. They can't just raise their rates $50 on you as an individual. They have to do it with everyone who's 72 on a Plan G in your area, if that makes sense. They cannot single you out. Premiums are expensive. You will need a Part D plan for your drug coverage. That's an extra cost. We'll go over that in another slide. So here's the open enrollment periods. The one that I want to show you is the initial open enrollment period is when you turn 65. You have 3 months before you turn 65, the month of your birthday, and 3 months after to enroll in Part A and Part B. Then you can join a Part D program, okay? At that point, you can also purchase a Medicare Advantage plan or a Medicare Supplement plan. No health questions. You're automatically approved. You're enrolled. Some of you, if you have a Medicare Advantage plan, your open enrollment is from October 15th to December 7th. Now, there's a bunch of other open enrollment periods here. General enrollment, there's OEP, a special enrollment period. It's all based on certain things in your life. Most of you are going to be turning 65, and the other portion of you are in open enrollment right now, okay? Those are the open enrollment periods. I'm not going to dive into this too much because it's based on your individual needs and wants. Now I'm going to give you an example of what options are available in Sacramento and Placer County for Part C Medicare Advantage plans. Okay. If you're in a different county, it'll be similar, but a little bit different. I just want to give you an idea of what we're looking at here. So in Sacramento Placer County, there's Hill Physician Group, Mercy, Dignity, same thing, and Sutter. If you have Hill doctors, or you want Hill doctors, or you want Mercy, the main companies that are in the area are Scan, Alignment, Imperial, and Central. There's tons others, but these are just the main players out there. I want to show you the star rating, 4.5, 4, 3.5, and 3. Scan is a nonprofit company. They are not a for-profit company. Nonprofit means they're only allowed to profit so much, and the rest of the money has to go back into the plan, which gives you better benefits and less out-of-pocket expenses. As you can see here, the max out-of-pocket, this is for your health care. Think of the worst case scenario in a year. This would be the most you would pay with all of your co-payments added together. Once you hit $2,000, you don't pay anything again. With Alignment, it's $3,500, Imperial's $3,000, and Central is $3,000. So the lower is the better. Doctor's visits, $0 across the board. Specialists, a little bit different, 0, 0, 5, and 25. Inpatient copay is $50 per day for 5 days, 100, 150, and 195. You can see it on the screen here. Emergency room, $90 with Scan, but it's waived if you're admitted. The good thing about Scan is it's waived if you're admitted. As we know as seniors, if you go to the emergency room, you're probably going to be admitted for at least a day. So that'll get waived. The other companies are a bit higher. Ambulance, $150 on up. Now, Part D is the drug max out of pocket. Previous slide, I told you it was $2,100. That's across the board. Every insurance company is following the same guidelines as Medicare set into play, which was $2,100 the max out of pocket. Take all of your co-payments. If they equal over $2,100 or exactly $2,100, everything past that, all of your prescriptions are free. It's going to be kind of hard to hit because all of your generics, tier 1 and tier 2, under Scan and most of these companies is $0. Now, if you have a tier 3 or tier 4, you're looking at $35, $42, and then you're looking at tier 5, which could be 35% of the drug and so forth. But once you hit 2,100, you're done. Give you an example. I've got a customer of mine or a client of mine. She takes cancer drugs, $17,000 a month. Her first month, she had to pay $2,100. Every month after that, she didn't have to pay a penny. May not be great, but it's a pretty good deal for her instead of paying $17,000 a month. All of these plans, because it's Part C of Medicare, funded by CMS, funded by Medicare, and remember I said they have extra benefits, dental, vision, hearing. They all have dental, vision, hearing. They're all slightly a little bit different. Some you have to go in network, some you have to go in network and out of network you can go. They all come with a flex card. What a flex card is basically free money. Scan, it's $110 every quarter and it rolls over. Alignment, Imperial, and Central, and most of the others, if you don't use it, you lose it. And dollar-wise, they're all about the same. I just wanted to give you an example of what's available and what the costs are. Now, if you prefer Sutter or your doctor is a Sutter doctor, here's what we're looking at for these two companies. Just again, examples, $2,500 out of pocket to $4,900 out of pocket. Doctor's visits, $5, and Alignment's a little bit more. Specialist, $20 and $25. As you can see, the differences for the Sutter plan. It's just simply the contract that this insurance company signed with Sutter, okay? That's how a Medicare Advantage Part C plan works. You assign your Medicare Part A and Part B to the Scan or Alignment or whatever company, and they then take care of you 100%. They do all the billing, the referrals, and what's approved and not approved. Hopefully that makes sense. The next slide, we're going to talk about Medigap. So, a Medigap policy or Medicare Supplement pays the difference that original Medicare, Part A and Part B, doesn't pay. You don't have to pay for anything. And one thing I wanted to note on here, this is not for a Plan F, this is for a Plan G. I apologize, I'll fix that later. So these are the two main companies that everyone's heard of. But if you're 65 male or 65 female, you can see the cost difference here between the two companies. They're both rated great. This is a Plan G. The only thing you're responsible for, I want to say that again, it's Plan G, I apologize. The only thing you're responsible for is a small deductible per year for the doctor's visit. That's primarily it. There's a few underlying things there, but I want you to understand the cost. You can go to any doctor, any hospital, any specialist, any lab, anywhere in the United States. $204 or 174 if you're a female. You will need a Part D plan, approximately $35 for each company, because the Part D plan is not part of Mutual of Omaha. It would be separate of Mutual of Omaha. So we'd have to search to find out the cheapest one based on the drugs that you take or the prescription that you take. The out-of-pocket max is still going to be the same as before because it's Part D of Medicare. But these plans do not have dental, vision, and hearing, and they do not have a flex card. But again, if you travel or going to any doctor, any hospital is super important to you and you don't care about the money, these plans are amazing. If you care about the money and you have no issues going in-network, now I want to talk real quick about what in-network means. Let's say you have a scan plan with Hill Physician Group and Hill, your doctor, refers you to a Sutter doctor or a Sutter specialist or Sutter hospital for, say, cancer treatment. They can refer you, and if it's approved, which generally speaking it's going to, the bill is going to be paid based on what you see on the screen. Okay, so don't overthink it too much. All right, what to do next? This is very simple, very easy. All you have to do is click the link below. There's a link there that has my name in it. It goes to my calendar. You can schedule a 15, well, we put on there it's 15 minutes, but I'm going to spend as much time as I need to with you. It's a Medicare strategy phone call. What that is for is so that you and I can sit down together, whether webinar or over the phone, and determine what is available in your area. Make sure your doctors and hospitals are on the network list. Go over pricing, go over everything that works for you, what your needs and wants are, and just figure out what plan is the cheapest for you. As long as we keep your doctors and hospitals the same, you're good to go. And you can do this at your convenience. Click the link below. It's down here somewhere, and that'll take you directly to my calendar, and then you can schedule something. Thank you for your time. I hope this didn't take too long. And if you do have questions, hit my website. I got a lot of videos on there and a whole bunch of reading materials if you're that type of person, or just schedule an appointment with me and we'll drill down pretty quickly what's going to work best for you, and then you can decide from there. Thank you. I appreciate your time.